Hey everybody, this is Dr. Danish. I wanted to talk about regenerative therapies for the spine. A lot of people don't know, but the most common reason people seek medical care is because they've injured their back. It's the number one musculoskeletal complaint, and across the board in healthcare, it continues to be a big black box. People don't quite have a solid understanding of the spine. But we as regenerative specialists have a lot of insight into this and can help a lot of people, and I wanted to talk about some of those options. So the first thing is why do we get back pain to begin with? Well, the spine is actually quite a complex organ. Here it is in a skeleton form. You could see that it's composed of multiple bones that are just stacked up on top of each other. And I think of it as like tripods, multiple tripods stacked on top of each other, where on one side right here, you've got the discs that are on the front side. And then on the back side, you've got these joints that help you move and take load from the disc. So you have those three elements that create stability. Well, a lot of times we focus on those structures and the nerves that come out of these holes. We focus on those structures and try to find a reason that the back hurts, attributing it to one of those things. And the reason that healthcare as a whole has been so focused on those structures is because that's what's evident under X-ray or an MRI, is those are the structures that are very visible. But the reality is the spine is much, much more complex than that. And if we look here, we can see some of that complexity. You can see how it's not just the bones and the disc. You've got a ton of ligaments here that also, and it's not lighting up. There you go. There's a lot of ligaments in here that create structural stability to the spine and are the reason why we're able to stand up straight without difficulty. And just as how you can get a sprain or a strain of your ankle, like if you roll your ankle, you get a sprained ankle, you can get a sprained back. The ligaments and tendons in your spine can actually be injured and cause a chain reaction that causes that like gripping pain. And that actually is the number one reason people hurt. The problem is that most of us also have some degree of degeneration or weakening in the discs as we age. And because that's more visible, the tendency in healthcare is to assign the problem to that disc. But really, ligaments and tendons are far, far more common as a cause of pain, and the disc may just be incidentally found. So the ligaments create that structural stability, and the muscles and tendons are what create movement. And if somebody is, for instance, doing a bending and lifting maneuver and they get back pain, the most common reason is that one of the tendons or ligaments in the body has been sprained, and the chain reaction that causes is everything goes into cramp mode or constriction mode to protect the body from further injury, because the body has very strong instincts to protect the spine. What we as regenerative specialists do is rather than looking just at the X-ray and looking at these hard structures, we want to look at the soft structures, and we can do that with this machine over here. It's called an ultrasound, which helps me visualize the soft parts of the body, like those ligaments and muscles, and able to understand in great detail where the origin of pain is. And once we know that, then we can go into a regenerative therapy, whether it's a matter of rebuilding that disc and hydrating it, trying to address some of the tears that can happen in the outer rings of the disc and cause sprains. Or we can look at the posterior elements, the joints of the back, and figure out if the joint is arthritic or unstable. Or we can look at the muscles, the soft tissue, the ligaments, and figure out where that instability is. And once we know what that is, then we can come back with some kind of regenerative therapy, whether it's prolotherapy, which is medications, PRP, which is platelet-rich plasma, or essentially growth factors that we get from your bloodstream, or even stem cells that we can harvest from your own bone marrow or fat cells. We can use those to rebuild whatever structure is damaged and take you from kind of that chronic recurrent or chronic persistent low back pain and improve you to the point where you're functional and moving and doing things the way they should be done. So anyways, if you have any other questions, feel free to reach out to us. I'm happy to answer any questions online or if you'd like to make a consultation, we're always happy to see you as a new patient and give you a better understanding of what's going on in your spine. Thank you.